Hey, welcome to my new antibiotics course, the best antibiotics discussion in the whole freaking world. Here are just some quick side effects to remember forever. Clindamycin can lead to pseudomembranous colitis. Chloramphenicol can lead to gray baby syndrome. It's not actually gray, it's cyanosis to be honest, but it's close enough. This is vancomycin, the van. It can lead to red man syndrome. Here is a red man. Vancomycin covers gram-positive cocci and rods. Next is the metronidazole. Here is your metro. It's used to cover giardiasis, Trichomonas vaginalis, and Entamoeba histolytica. It can also treat the Clostridium difficile, which was caused by the clindamycin. Side effects of the metronidazole include metallic taste, mucosal inflammation, disulfiram-like effect, inflammation of the bladder or urinary tract problems, as well as peripheral neuropathy and maybe some rash. So here is the deal. Clindamycin can cause pseudomembranous colitis. Vancomycin and metronidazole can treat the pseudomembranous colitis, which is caused by the nasty Clostridium difficile. Now let's make some assumptions. Whenever I use these symbols, I mean those kind of words. When I use this, I mean the uses, the clinical uses of the drug. These are the pharmacokinetics. Resistance, how does the bacteria resist the antibiotics? Adverse effects, hepatotoxicity is the angry liver, nephrotoxicity is the sad kidney. This is liver enzyme inducer. By liver enzyme, it's usually the P450 system. It induces the P450 system, and this means it inhibits the P450 system. This is an oral drug. The blue one is an intravenous drug. The dark red one is intramuscular drug. This is chlamydia, the famous clam. This is a topical drug. This is drug-drug interaction, when you add two drugs together that you're not supposed to add them together. This is a gram-positive cocci and a gram-positive rods because they stain purple on the gram stain. This means that the drug is toxic to your brain and might cause seizure. This denotes neuropathy. This depicts myopathy. Here's the deal. Learning antibiotics or anything in life in general is a mind game. It's a mindset. Whatever the mind can conceive and believe, it can achieve. If you believe that you can do it, you will do it. If you believe that there's no way in the world that I'm gonna understand antibiotics ever, you will never understand antibiotics, like ever. Antibiotics are here. They are called the antimicrobials. They could be antibacterial, antifungal, antiviral, or antiparasitic. Antibacterial are against your nasty bacteria, and they include the anti-tuberculosis drugs, which will be divided into primary and secondary. The primary is the famous RIPE. R is for rifampin, I is for isoniazid, P is for pyrazanamide, and E is for ethambutol, which causes green and red color blindness. Antifungals include the azoles, not only the azoles but also amphotericin B, nystatin, echinocandins, flucytosine, griseofulvin, etc., etc., etc. Antiviral could be divided into anti-HIV, also known as HIV, also known as the HART therapy, which stands for highly active antiretroviral drug. The HIV virus is a retrovirus. Why do we call it retrovirus? Not because it wants to go back to the good old days, but because it has a reverse transcriptase, which will get the RNA and transform it back to its original form, which was the DNA. Let's talk about the first one. Antibacterials are either cell wall synthesis inhibitor or disruptor of cell membrane. They can inhibit the wall or the membrane of the freaking bacteria. Or they could be protein synthesis inhibitor. They inhibit translation and protein formation. Or nucleic acid synthesis inhibitor. By nucleic acid, I mean DNA and RNA and everything in between. Now, this is the most important diagram in this lecture. Since the Apple iOS 13 now has dark mode, let's add my dark mode of antibiotics. They are either antibacterial, antifungal, antiviral, or antiparasitic? Okay, we got it. What do we have here? We have the antibacterials include cell wall synthesis inhibitors. And if I want to write something here, what should I write? Like here, protein synthesis inhibitor. And then if I want to add something here, I should add what? Nucleic acid synthesis inhibitor. Alright, protein synthesis are either 30S inhibitors or 50S inhibitors. Excellent. Nucleic acid synthesis inhibitors are either direct, which will be the living crap of DNA, RNA, and transcription, translation, stuff like that, or indirect, they are just folate antagonists, and of course, they can lead to megaloblastic anemia because they inhibited your folate. And here is the most important diagram in this video. Here is the penicillin, cephalosporin, carbapenem, monobactam, the one and only aztreonam, vancomycin, aminoglycosides, tetracycline, macrolides, clindamycin, sulfonamides, quinolone, and metronidazole. This means gram-positive cocci. This gram-positive rod, this is a gram-negative cocci, and this is the Treponema pallidum. This is a spirochete under dark field microscopy. So penicillin covers gram-positive cocci, gram-positive rods, gram-negative cocci such as Neisseria meningitidis. This was just a preview of what to expect. You can download it today. Thank you so much. This is Medicosis Perfectionalis, where medicine makes perfect sense.